The digital health market continues to grow at breakneck speeds. Venture funding has increased to over $1 billion in this sector, doubling year over year. Traditional healthcare delivery infrastructure is shifting to enable anytime, anywhere access with stringent requirements for data privacy, security, and outcomes-focused reliability. With us on our program today is Naveen Goven. He's founder and CEO of Aventon. And Naveen, welcome to the program.
Thank you. Glad to be here.
I hope I pronounced your name correctly.
Yes, you did.
Great. Well, let's get going. We have a few questions for you today about the digital health market and the climate right now in that market. The first question is that Aventon provides connected information processing solutions. What challenges do you see as the network of the future becomes more software-based?
We are continuing to see an evolution going from prior heavy IT-based legacy type of enterprise systems to more cloud-based computing. Coupled with that, we see a lot of different types of mobile-enabled devices that are making their way not just into consumer hands, but also being sort of adopted into an enterprise framework. And for that, there are heavy burdens in terms of computing, security, privacy, and more importantly, how a lot of these systems are designed to be interoperable, so to speak. So we have numerous challenges to address in terms of how these different compute models are evolving and how the network is geared towards managing this increased amount of data flow with also burdens on security and privacy.
Naveen, of course, you know it's important that consumers feel safe about sharing clinical information. What advances in security do you think will be made over the next, let's say, few years?
We are seeing continued evolution going from data warehouses that typically hosted a lot of the patient information on the back end, but as you rightly mentioned, with a lot of the devices that are more consumer-centric. For example, when we're looking at chronic disease conditions and trying to enable patient engagement models, patients typically have, let's say, a diabetes ailment and are managing their ailment through the use of mobile-enabled devices by collecting glucose readings on a daily basis. And that goes into a device where this data gets collated and formatted and basically hosted on a personal device. Now, the challenge there is how do you meet encryption needs? How do you meet privacy compliance? And again, in the context of sharing this information, if the patient is moving this data into a larger enterprise or an EMR system, how does that integrate into a larger EMR system and consent forms managed? We typically have been able to encrypt a lot of these types of data formats, either at two bookends at endpoints or while data is in transit. And we are seeing the evolution of that take place where we can now do that effectively on mobile devices as these devices have become more powerful. So we can do authentication, we can do encryption, and then we can do a lot of the other types of security types of compute models to enable class actions, break scenarios, and so on. And that can happen, and it is happening, but it's an evolutionary sort of a move.
Naveen, your company brings about standards-based innovative solutions to the healthcare marketplace that enable electronic health information sharing and connects medical devices and assets. What's the importance of adhering to standards in the development and deployment of e-health products and services?
I would say that it is extremely critical that we conform to standards to a large extent. Or at least at the very minimum, having a standards guideline in terms of how these different types of heterogeneous devices talk to each other and be able to be interoperable. In today's world, just to give you an example, you could, again, going back to the diabetes use case scenario, so to speak, you have a glucose monitor that's Bluetooth enabled, that's communicating to a smartphone or a tablet via wireless technology. Now, that pairing and then the subsequent movement of the data from the device to a cloud or to the backend, in one instance can happen using a certain set of, shall we say, proprietary sort of solutions. Now, when you have a multitude of these devices talking to each other, it is of extreme importance, not just from interoperability or a technology standpoint, but also more so in the case of enabling new business models and scale. And standards can do that effectively. So having an API that a device vendor can adopt and write software to, that interoperability can go a long ways in ensuring not just the fact that these devices can talk to each other and ultimately data integrity and resiliency, but also more importantly, enable new business models that can have a big economic impact across our ecosystem in the digital healthcare domain.
Naveen, we'd like to wrap each one of our interviews for our Network of the Future channel, asking you about your futurist perspective, if you will, about your particular vertical. Where do you see the healthcare industry over the next, let's say, few years?
We are seeing a significant shift from volume-based care to value-based care. And what that means is we are seeing a lot of the conditions that we live as humans every day in an aging population. A lot of the care models that used to be hospital-centric are now geared towards enabling care in the home. And for that, what we are seeing is that more and more of these type of medical devices that are typically used in a hospital setting moving towards a home-based type of a setting. So that's one trend that we are seeing, and we're going to continue to see that grow, where bedside type of vital sign monitoring devices can now be used in a home-based type of an environment. We also see, as I alluded to, care moving from hospitals to more home-based or remote-centric. That's something that we're going to continue to see a shift happen. And last but not least, we also see a lot of what we call whole genome sequencing coming to the forefront as costs for these type of sequencing methods continue to drop. And we would be able to predict adverse events much more effectively and quickly to reduce patient-related issues and improve patient outcomes and ultimately quality of life.
Naveen, of course, as you know, you are on our Big Data and Security track at our June conference. That's TIA's Network of the Future conference on June 3rd through 5th. What do you expect to get out of that particular panel discussion, that discussion?
I think at the very least, we are on a path towards education and awareness, creating a lot of the member organizations, attendees to be able to not just look at the technology component, but also the big picture view. We have extremely knowledgeable panelists that are expressing not just their opinions, but also sharing their experiences as they see the digital healthcare ecosystem move forward. So there will be an outcome, we hope, that will enable cross-collaboration, because it's very critical that that happens for everyone to be successful in this space, whether you're coming from the technology domain, the clinical domain, you could be a service provider, or could be an investor looking at this very fast-moving sort of ecosystem where there are plenty of business opportunities to be able to monetize investments that are going into this space. So we expect to have a fairly robust discussion and a conversation and a sharing of ideas.
Naveen Govind, founder and CEO of Aventon, we appreciate your time, and of course we'll see you in early June.
Thank you for having me. I look forward to the event.
I appreciate it. Thank you very much.